Assalamualaikum warahmatullahi ta'ala wabarakatuh. For today's video, we will discuss the review of systems. So previously, na-discuss natin yung iba't ibang overview natin sa physical health assessment. So na-discuss natin yung overview with the nursing process, and we have also discussed the different methods, okay, in head-to-toe assessment, how do we gather subjective data. So now, let's start discuss the different major body systems. Okay, ano yung mga ina-assess natin? So, you have already took your anatomy and physiology and you're very well known to the different major body systems, no? So, you have the 11. So, ito yung isa-isahin natin. So, let's start discussing the assessment of integument or assessment of the integumentary system. So, this includes the skin, the hair, and your nails, and also the glands that is distributed all throughout your body. So let's discuss first, or let's have an overview of the anatomy of the different components of integumentary system. So ano ba yung ating integumentary system? So the word integument, or the word integument means a covering, no? So it's a protection. So we have five major functions of our skin, no? Or our integumentary system. The first one is for protection. Okay, so ito po ang ating skin, ay ito po ang ating first line of defense natin against microorganisms. The skin provides protection against abrasion and ultraviolet rays, and also prevents microorganisms from entering the body and reduces water loss, thus preventing dehydration. Another is for sensation. The integumentary system has sensory receptors that can detect heat, cold, touch, pressure, and pain. Kaya tayo nakakaramdam ng init, ng lamig, ng touch sensation, okay? Pressure and pain, it's because of the sensory receptors that is located in our integumentary system. Next is for vitamin D production. So when exposed to ultraviolet rays or ultraviolet light, the skin produces a molecule that can be transformed into vitamin D, an important regulator of calcium homeostasis. So in case na nagkakaroon ng mababang calcium sa ating blood, nare-release itong vitamin D to cope up with this loss of calcium in our blood. Okay, so next is for the temperature regulation. So the amount of blood flow beneath the skin surface and the activity of sweat glands in the skin both help regulate the temperature. 'Di ba? Napapansin niyo naman, 'di ba? Pag malamig yung ating weather, mainit yung ating katawan. We preserve heat, hindi tayo naglalabas ng pawis because kino-conserve natin yung heat sa ating katawan. While as pag we are exposed to hot environment, nilalabas natin yung init ng ating katawan through perspiration. Through that, nagkakaroon ng regulation ng ating temperature. And last function is the excretion, or the small amounts of waste products are lost through the skin and in gland secretions. Kaya nga sa ating mga sebaceous glands and sweat glands. Diba? Sebaceous glands is yung lumalabas ng mga oil. Lalo na sa ating mga mukha, and then sa sweat glands sa iba't ibang parte ng ating katawan. So what are the components of our integumentary system? So yun na nga kanina nasabi ko or na-mention ko that this includes your skin, your hair, nails, and your glands. So ito yung isa-isahin natin ng mga components. So let's start with the skin. So we all know that we have the different layers of the skin, okay? So we have here the epidermis, the dermis, and your hypodermis. So the epidermis is the most superficial layer of the skin. It is a layer of epithelial tissue that rests on the dermis. So just below the epidermis, ando doon yung ating epidermis, which is a layer of dense connective tissue. So the epidermis prevents water loss and resist abrasion. Your dermis naman is responsible for most of the skin's structural strength. And also, the thickness of the epidermis and dermis varies depending on the location. But on average, the dermis is much thicker, no? 10 to 20 times thicker than the epidermis. And the skin or the rest of the skin is what we call the hypodermis, or also known as your subcutaneous tissue, no? So it is not part of the skin, but it does connect the skin to the underlying muscle or bone. So sa hypodermis na yan, andyan dyan yung subcutaneous tissue natin, and dyan din nagsastart yung connection ng ating muscle or bone. So next component is the hair. Okay, so yung mga buhok sa ating kilikili, buhok sa ating ulo. So what are the functions of our hair? So first, it insulate against heat and cold. Okay? It protects against ultraviolet and infrared rays. It perceives movement and touch. It protects eyes from sweat, kaya nga meron tayong eyelashes dyan and eyebrows, and protect nasal passages and ear canals from foreign particles. So, yung mga sa ilong natin, may kita niyo dyan, yung may mga hair dyan, which traps the microorganisms para hindi agad-agad makakapasok sa ating ilong. Okay? And your ear canals. The same din, tinatrap nila yung mga iba't ibang microorganisms na pwedeng pumasok sa ating katawan. Okay, so in human, hair is found everywhere on the skin except lang sa ating palms and the soles, the lips, the nipples, and the parts of genitalia. Okay, hindi naman lahat ng genitalia mo ay mabuhok. And the distal segments of your fingers and your toes. Okay, so next component is your before we go to the next component, let's discuss first the components of the hair. So we have the hair shaft, which is the flexible strands of keratinized cells. We have the root, which is below the skin, or yan yung nasa scalp natin. Nandoon may kita ninyo dito, ito siya, this is the root, yan. Okay, so ito, nagsa-start papunta dito sa baba. Okay? And then we have the hair bulb. Okay, this is the hair bulb. 'Di ba pag kinukuha nyo yung hair ninyo or binubunot ninyo, may maputi-puti doon. That's your hair bulb, okay? Or the base of root or where hair is produced. And you have also your hair follicle, which is a group of cells that surround the root and bulb and gives hair different shapes, okay? So, next component of integumentary system is our nails. Okay, so nails or the nail is a thin plate consisting of layers of dead stratum corneum cells that contain a very hard type of keratin. So the integument includes the skin, the hair, and the nails. And the examination begins with a generalized inspection using a good source of lighting, preferably indirect and natural daylight. So kasama din po sa ini-inspect natin is yung ating nails. So ito po yung ating parte ng ating nails. May kita nyo po dito, we have the free edge. Okay? Ito yung, what do you call this? Kinakat natin every now and then. We have the nail body, we have the aponicum, the nail root, and the nail matrix. Okay, so yan yung mga parts ng ating nail. So we have the different nail structures. The nail body is the visual part. The nail root is covered by the skin. The cuticle is the stratum corneum that extends into the nail body. We have the nail matrix, continuation of our nail root, and give rises to most of the nail. We have the nail bed, which attaches to nail and is distal to the nail matrix. And we have also the lunula, the part of nail matrix, the whitish or the crescent shape area of the nails or the base of the nail. So ayan po siya. We have the free edge, the nail body, the lunula, the cuticle. Okay, ito siya. 'Di ba pag pumupunta ka sa manicure or pedicure, usually kinakat to siya. Okay, may mga iba ginagawa nila yan para for extension of nails, dinadagdagan nila ng mga cuticles, yan. And we have the nail root. Okay? So, ayan, sa loob. Or the, another part, ano to? another view, no? This is the anterior view and ito naman yung sa loob niya. Okay, so now let's go with the assessing the skin. So paano ba natin ina-assess yung ating skin? So we always begin with general questions about the skin, such as how would you describe the condition of your skin? How does it compare to what is like a couple months ago? So kumaga more on subjective muna, no? We ask our patient this kind of questions. Pwede nating tanungin din, do you have an increased sweating at a certain times? Okay? Kasi too much sweat loss can contribute to heat stroke. Kaya nga 'di ba pag hilara ka sa mainit na mainit or under the sun, and then sobra yung pagsusweat mo nagkakaroon, or this can lead to heat stroke. Okay? So have you noticed any color changes in your skin? Because if meron, anong parte ng inyong katawan? Okay, sa mukha lang ba? Okay, sa buong katawan ba? Because these skin changes or color changes, may iba't ibang meaning to. So, i-discuss lang natin further, no? So, do you have any itching of your skin? Okay, saan ba yung Makati? Kasi baka merong mga lesions dyan, merong mga rashes. And ano yung occurrences niya? How severe is this? Na parte lang ba ng, isang part ba lang ba ng inyong katawan? Or buong katawan nakadistribute itong iba't ibang uh, lesion sa inyong katawan or rashes? Okay, so yung mga questions na yun, we will start on discussing that one, no? I mean, asking our patient by gathering the subjective. Afterwards, tsaka na tayo mag-gather ng objective data. So, dito na natin i-observe the skin's overall appearance, yung itsura, no? Okay? So, observe for cleanliness and use the sense of smell to determine body odor. Okay, baka mabaho naman yung pasyente mo. Unang sabak mo pa lang, unang meet mo pa lang sa pasyente mo, amoy na amoy mo na yung mabahong amoy na manggagaling sa kanya. So you observe that one or you take note of that one, no? So inspect the skin color. Okay, fair ba siya? Light ba siya? Dark ba siya? Okay, may mga parts ba ng kanyang skin na maputi and then maitim? Okay, so yan, you inspect for the skin color. Inspect for the uniformity of the color, or if it is widely distributed na pare-pareho yung color ng kanyang skin. Look for localized areas of bruising, cyanosis, okay? Pallor, jaundice, erythema, petechiae, rashes, vitiligo, and albinism. So, cyanosis is the bluish tinge. Okay? Cyanosis po is the bluish discoloration. Okay. Bakit po nagkakaroon ng cyanosis? So, it is, due to cause of, what they call this, poor oxygenation sa ating skin. So, pag poor yung ating oxygenation sa iba't ibang tissues and cells, pwede nagkakaroon ng bluish tinge ang ating skin. It is mostly evident sa ating nails or nail beds, sa ating lips or buccal mucosa. So, in dark colored skin ng mga patient or dark skin clients, close inspection of the palpebral conjunctiva or the lining of the eyelids and palms and soles may also show evidence of cyanosis. Pag naman pallor, it is the result of inadequate or kulang na circulating blood or hemoglobin and subsequent reduction in tissue oxygenation. Yung parang namumutla ka. So, just imagine yung mga anemic patient. Yung mutla yung mukha niya, yun po yung ating pallor. No? So, in black skin clients, the skin may appear ash and gray. Hindi siya more on parang mutla siya, but sa kanila, because they are dark colored, so ash and gray, may pagka-grayish yung kanilang pallor na skin. So, pallor in all people is usually most evident in areas with least pigmentation, such as your conjunctiva, okay, sa inyong mata, the oral mucosa membranes, kung ano yung mas least yung pigmentation niya or hindi reddish. Kasi doon natin ma-appreciate talaga na okay, pallor or pale talaga yung ating patient. Okay? Pag naman sabihin natin jaundice is the yellowish tinge. Kung ang cyanosis is the bluish tinge, ang ating jaundice is yellowish. Okay, so yellowish or ano to? Yeah, yellow. Okay, so parang the color of banana. So this may be first be evident in the sclera of the eyes. May kita nyo sa sclera ng mata pag may kita nyo na yellow na siya. So pwedeng this can be an evidence na merong liver problem or liver problem ang ating patient. Okay, so this can also be seen sa mucous membranes and also the skin. So the nurse should take care not to confuse jaundice with the normal yellow pigmentation of the sclera in the dark-skinned client. So make sure lang po sa mga dark-skinned client, take note na normal po sa kanila na yellow yung kanilang mata, but light yellow. Pag nag-dark na po, meaning yun na po yung ating jaundice. So if jaundice is suspected, the posterior part of the hard palate should also be inspected for yellowish color tone. So, pag sabihin naman nating erythema is the skin redness. So, this can be caused by a variety of rashes or other skin condition. So, pag sabihin naman nating vitiligo, it is a patches of hypopigmented skin and it is caused by the destruction of melanocytes in the area. And pag sabihin nating albinism, ito yung sa term natin sa mga Filipinos or Tagalog is yung mga anak araw kasi mga puputi sila. It is the complete or partial lack of melanin in the skin, hair, and eyes. So, ayan po yung ating uh, iba't ibang pigmentation, no? So, yan yung ating bluish tinge, the cyanosis. Okay? Yan. Yan siya. Okay? We have the pale conjunctiva or pallor. Yan yung sinasabi kong pallor. Okay? The jaundice. Okay? Makita nyo yung sclera niya is yellow and also the skin is yellow. Okay? We have the erythema. Okay? And then we have the erythema din also. Okay? So, this can be a rash. And also, this one is your this can be caused by erythema also or skin rashes or other skin condition. Ito naman po yung sinasabi nating vitiligo or patches of hypopigmented. Ito po yung tanungin niyo muna yung patient niyo kasi pwede itong maging cause din ng ating burn. Kumaga kung nasunog yung part ng kanyang body, talagang magkakaroon ng ganyan. But, meron tayong condition din na vitiligo na pinanganak talaga na merong ganyan na condition or skin condition. Ito naman po yung ating albinism. Okay, so yan yung mga i-inspect natin sa ating patient. Okay, so inspect and palpate the skin's texture, the temperature, noting its thickness and mobility. So, determines client's skin temperature. So, in determining the temperature of the skin, you use the back of the hand, mostly of your use the most back of the hand kasi doon natin mas na-appreciate yung iba't ibang temperature. Hindi katulad sa ating palms kasi alam naman natin na mainit na to. So, ito pa yung gagamitin natin para i-feel kung may lagnat ba or mainit ba yung katawan ng ating patient. Mararamdaman natin na talagang mainit siya because yung palms natin is mainit. So, you make sure that you use the palm of your hands. Okay. So, for the body temperature, this reflects the balance between the heat produced and heat lost from the body, and it is measured in heat units called degrees. So there are two kinds, the core temperature and the surface temperature. Pag sabihin natin core temperature, this is the temperature of deep tissues of the body, and the surface is the temperature of the skin, the subcutaneous tissue, and the fat. So, ano yung mga factors that can cause heat production and heat loss? For the heat production, okay, we have basal metabolic rate, exercise and shivering, secretion of thyroxine, epinephrine, and norepinephrine, and inflammation and fever. Okay, so nagkakaroon tayo ng heat nakaka-produce tayo ng heat through that different factors. And nakaka-loss tayo ng heat through these factors naman, through radiation, through conduction, through convection, and through evaporation. Okay, so what are the factors? Okay, so ito, isa-isahin natin yung kanina na pinakita natin na picture, no? Basal metabolic rate. Ano po yung ating basal metabolic rate? This is the rate of energy utilization in the body required to maintain essential activities such as breathing. Muscle activity such as or including your shivering can increase the metabolic rate, kaya nga nagkakaroon ng change sa ating heat production. Meron thyroxine output or the hormone that is produced by your thyroid is released in our body, meron siyang effect because this increases the rate of cellular metabolism all throughout the body. The release of epinephrine, norepinephrine, and sympathetic stimulation or stress response, or the activation of your sympathetic nervous system. So these hormones or this response can increase the rate of cellular metabolism in many body tissues. And for the fever, it increases cellular metabolic rate and thus increases the body's temperature further. So ito yung factors na nag-increase ng heat ng ating katawan. While as for the heat loss, okay, so ano naman yung mga factors or ways para mawala yung ating init sa katawan. So first, we have through radiation, the transfer of heat from the surface of one object to the surface of another without contact between the two objects. So walang contact, so nagkakaroon lang ng heat release, that is through radiation. Conduction naman is the transfer of heat from one molecule to a molecule of lower temperature. Pag convection naman is through dispersion of heat by air currents. Yung conduction po natin is through contact, no? Pag nagkakaroon ng contact from lower from higher temperature to lower, nagkakaroon ng transfer dyan ng heat. And for evaporation is the continuous vaporization of moisture from the respiratory tract and from the mucosa of the mouth and from the skin. So, this is through water vapor. So, yun naman po yung mga factors na nakaka-release naman tayo or nawawala yung ating heat sa ating katawan. So, we have the different terms here na kailangan you need to be familiar with the alterations in the body temperature. So, the normal body temperature po ng isang tao is nasa 36 degrees Celsius or up to 37.5 degrees Celsius or 96.8 degrees Fahrenheit to 99.5 degrees Fahrenheit. Okay? So, pag we have the different types of fever, no? So, we have the intermittent, remittent, relapsing, and your constant. Pag sabihin natin intermittent fever, this is the body temperature alternates at regulate intervals between periods of fever and periods of normal and subnormal temperature. So, yung kumbaga, pawala-wala yung lagnat, that's the term na intermittent. Pag naman remittent, a wide range of temperature fluctuation. So, this means lang na this can never return to normal. Kumbaga, talagang mataas na siya yung temperature mo, pero lumiliit siya but within the higher na temperature. So, yun yung remittent. That's the difference between the intermittent and remittent. Pag sabihin natin intermittent is bumaba siya or bumabalik siya sa normal temperature while as your remittent, hindi na. So, the relapsing naman is the short febrile periods of a few days which are interspersed with periods of 1 to 2 days normal temperature. And your constant is the body temperature fluctuates minimally but always remains above normal. So, yan yung ating iba't ibang types of fever. So, we have the term hypothermia. Pag naman hypothermia, the core body temperature is below the limit of normal. Okay, so yan yung hypothermia. By the way pala, yung fever, we can also use the term hyperthermia kasi increased yung kanyang body temperature above the normal body temperature. So, we can use the term hyperthermia to say na may fever yung ating patient. So, there are three physiological mechanisms of hypothermia. So, ito po yung mga reasons kaya nagkakaroon ng hypothermia ang isang tao. So, nagkakaroon due to excessive heat loss, inadequate heat production to counteract heat loss, okay, and impaired this one is hindi siya kana. This is the second one. Kasama siya sa second one, no? Inadequate heat production to counteract heat loss. And lastly is the impaired hypothalamic thermoregulation. So, ito po yung tatlong mechanisms na nagkakos ng hypothermia. So, here are the different sites naman po, okay, para kumuha ng body temperature, no? So, we have here oral, okay? It is accessible and convenient. However, ang disadvantage niya is pwede siyang inaccurate if the client has ingested hot or cold food. This could injure the mouth following oral surgery, and thermometers can be break if bitten, no? So, for rectal naman, this is a reliable. Ito po yung pinaka-reliable na measurement natin when we want to measure the core body temperature kasi nasa loob eh. So, it is inconvenient however kasi syempre sa puwet and unpleasant for clients, difficult for client who cannot turn to side and could injure the rectum. Pwedeng for long periods of using rectal thermometer, pwedeng magkaroon ng loss of sensation sa bandang puwet, no? So, magkakaroon ng problem sa pag-release ng stool pag ganon. So, pag naman sa axillary, it is the safe and non-invasive na site na pagkukuhaan ng ating body temperature. So, the thermometer may need to be left in place in a long time to obtain an accurate measurement. So, hinihintay natin na mag-beep muna siya, no? Para makuha natin yung accurate. So, yan. Ito yung ginagamit natin for oral or rectal, pwede yan. And ito, as you can see, pag oral or rectal, medyo mahaba yung pahaba. Kasi syempre, it is sa loob eh. Unlike ito sa ating axillary, mostly mababa lang yung ating metal part, no? So, we have also the tympanic membrane. So, sa tympanic membrane, ito po yung nasa tenga natin banda. It is readily accessible and reflects the core temperature and it is very fast. So, sa ibang countries actually, they use tympanic membrane. Unlike dito sa Philippines, we are mostly reliable to axillary. And nung COVID din, mas nagamit natin yung temporal artery, yung dito sa noo, no? So, not safe and non-invasive. This requires electronic equipment that may be expensive or unavailable. Variation in technique if needed if the client has perspiration on the forehead. Okay, so yan yung ating iba't ibang sites. Okay, we have oral, rectal, axillary, tympanic membrane, and temporal artery, the different sites of body temperature taking. Okay, so pwede yan yung ating sa temporal artery, yan siya. So, next is assess edema if present and describe. So, ito po yung pag 1 plus, nasa 2 mm lang po yung pagbaba. Pag sabihin po nating edema kasi is the swelling of the skin. May namamaga or somewhat merong tubig na stuck sa ating interstitial spaces kaya nagkaroon ng edema. So, 1 plus 1 pag 2 mm yung pagbaba, okay? 2 plus pag 4 mm, 3 plus pag 6 mm, and 4 positive or 4 plus pag 8 mm yung pagbaba or pag-dense ng ating skin, no? So again, edema is the presence of excess interstitial fluid. So it appears swollen and taut and tends to blanch in the skin color. And if accompanied by inflammation, it can be reddish na pamikita natin. So ayan yung ating edema. Okay, so ito yung pitting edema and non-pitting edema. Pag sabihin naman natin pitting edema and non-pitting edema, pag pitting edema is nagkakaroon ng indention, makikita nyo, this is a pitting edema. Pero pag hindi siya, walang indention, it is what we call the non-pitting edema. So measure the circumference of the extremities using tape measure, inspect, palpate, and describe skin lesions for characteristics, pattern, location, and distributions if meron. So we have here different lesion shapes. Okay? Pag discoid, it is more on round and oval. Annular, circular with central clearing. And we have the bull's eye, annular with central internal activity. Ito yung usually na yung nakikita natin sa carbuncles. Okay? May nana sa loob, yan siya. We have also the different lesion configuration. So, pag discrete, it is separated and distinct. So, malayo-layo sila. Grouped or what we call the clustered one. Confluent is not visible or palpable but may kita mo na merong umbok dyan. That is the confluent. And dermatomal is a line or it is configured through a line or an arc and follow a dermatome. Okay? So, for lesion distribution, it can be generalized, which is all over the body, regionalized, which is a specific to or limited to one area. It can be localized to a specific area, and it can be scattered or dispersed. It can be exposed in the exposed areas such as sa neck, sa ating face, sa ilong, sa mukha, yan siya. And then we have intertriginous or the skin comes in contact with itself. Yan siya. So we have the three different types of skin lesion. Pustules po is what we call yung, may kita nyo yung small pus filled lesion. Yan po yung mga pustules. Yan po yung cyst, a closed sac in or under the skin. So, wala siya, hindi mo makikita yung kanyang discharges. Okay, we have the nodules, a raised lesion detectable by touch. We have the wheal, a raised reddish area, commonly itchy. Okay? We have the fissure, a painful crack-like lesion. So, talagang nag-crack na siya. So, naghiwalay yung skin, no? We have the bulla, a large fluid-filled blisters. Okay, 'di ba? Usually pag napasok ka, okay, mga blisters, pwede yan, ganyan yung itsura niya. We have macules, small discolored patch. Ito yung nakikita natin sa measles or sa mga pasyente natin na merong chickenpox. Okay, we have vesicles, small fluid-filled blisters. Ito din yung nakikita natin sa mga chickenpox patient. We have the papules, pwede din to. Okay, a solid raised lesions. And we have the ulcer. Yan, yung talagang nagkaroon na ng activity sa loob na nagkaroon na ng butas yung ating skin. Okay, so we have the stages of pressure ulcer. Ito po yung makikita natin pag lalo na sa mga pasyente natin na bedridden. So ito yung ating stage 1. Okay, makita nyo na more on superficial. Stage 2, medyo nagkaroon na ng matatanggal yung skin. Stage 3, ayan siya. And then stage 4, talagang medyo malaki-laki na yung butas niya. So, yan yung ating skin ulcer or ulceration. So, common skin disorder na pwede nating ma-encounter, okay, when assessing our client. We have contact dermatitis, psoriasis or psoriasis. We have urticaria, which is usually ito siya lumalabas pag nilalamig. Okay, sobrang or exposed yung ating patient to extreme temperature, nagsisilabasan yan siya. We have also the scabies, the herpes zoster, and your tinea corporis. Okay, yung parang kuto, tinea corporis po is it is caused by a kuto sa nakikita sa skin. Usually yung mga may buhok-buhok, makakapal yung buhok niya sa katawan niya, sila yung nagkakaroon ng tinea corporis. Okay. So, Next is observe and palpate for skin moisture. So yan po, kinukuha natin or chine-check natin yung skin turgor niya. So dito natin detect, if hydrated yung ating patient or nagkakaroon siya ng dehydration. Okay? So before that, okay, quick lang, no? When you're trying to be strong but your antok is stronger. So, yan yung itsura po ng mga estudyante during classes na face-to-face. A segue lang natin para hindi masyadong heavy yung ating discussion, no? Na feeling mo, pag pagod ka na, parang kinakaya mo na lang, okay, sige, okay, kaya pa to. Okay. So, ano to? What passing cheats in exam, what teachers see, what we feel. Oh, yan. Okay. At the same time din, pag nag-cheating yung mga student, feeling nila, hindi sila nakikita ng kanilang instructor. Yung pala, maliwanag na maliwanag. Okay. Waiting for the perfect man. Okay. Nagkaroon na ng alikabok. Okay? Yung kalahati na lang ng upo mo sa jeep pero kailangan pretty pa din. Ayan daw. Tinitilian ako ng sanglibutan tapos ipapahiya mo lang ako, Liza Soberano. O, di ba? Yung ating EPs, nagreklamo na siya. Me on the outside and me on the inside of my headphones. Yan. When someone is testing your patience and you're crazy, side is about to show or shine bright like a diamond. Yan. Okay, next is assessing the hair. Okay, so mapunta naman tayo sa ating hair. So tapos na tayo sa ating what do you call this? Skin, no? So sa hair naman, so we ask our patient, how would you describe the condition of your hair now, no? Baka pwedeng sabihin ng patient, naka-experience ako ng hair fall, masyadong frequent ngayon, no? How does pwede mo siyang i-compare from previous, no, or months ago. So meron tayong question din na how often, no? Do you wash your hair? Kailangan yan. Tatanungin natin sa patient. And have you noticed increased hair loss recently, no? So, yan yung mga iba't ibang question natin sa ating patient. So, ano yung kailangan nating i-inspect? First is observe for and note for the distribution, quantity, texture, and color. Inspect the evenness of growth over the scalp. So, normal is evenly distributed. Yan, si Sarah G, ang kanyang buhok. Mga abnormal naman is alopecia areata. So, alopecia areata yan. May mga patches po sa ating scalp na walang hair o hindi tinutubuan ng buhok. Okay, so you take note niyan, abnormal po yan siya. Inspect also the hair texture and oiliness. So, if it is smooth, rough, very oily, hindi oily, very dry, okay? Inspect for the hair thickness and thinness. Note for the presence of infections or infestations. Baka merong mga dandruff dyan, merong mga patches na skin lesion sa kanyang scalp, merong mga kuto, lisa, yan. So, abnormal, we have the tinea capitis, folliculitis, we have the furuncle. Okay, pag sabihin natin folliculitis is infection of hair follicle that appears as pustules with underlying erythema, and furuncle is caused by infected hair follicle, no? So, yan siya, ayan yung ating folliculitis. Okay, somewhat parang dandruff na sa sobrang pagsascotch mo, nag-infect na siya, yan yung nangyari. Okay? Ayan naman yung ating furuncle. Okay? Yan yung mga malalang cases. Okay? So, inspect amount of body hair. Sorry, this is body hair. Sorry. Okay. So again po, yung pag-assess ng hair is hindi lang po yung hair scalp, but also the body hair. So you inspect for the body hair. So abnormal is hirsutism. So yan yung mga sobrang dami ng kanyang hair sa katawan. So hirsutism po ang term natin dyan, no? So next, let's go with the another as a component of the integumentary system, assessing the nail. So we have the conditions, we have questions somewhat. How would you describe the condition of your nails now compared to previous months ago? Okay. Have you been ill recently? Okay. So pwede yan siya. So assessing the nail, you examine the nails for color, shape, thickness, consistency, and contour. So the nail color should be pink and light skin people and brown naman siya pag dark skinned people. The nail surface should be slightly curved or flat and the edges is smooth and rounded. So ayan siya, no? So ito yung normal. So ayan, kung makikita ninyo, ito yung mga abnormal. Yan siya, abnormal yan. So, mga problems, very ko na yan siya na makikita nyo na very evident na may problem sa nails ang ating patient. Okay? So, normal po, ito po yung itsura ng normal. Okay? Ayan. No? Makikita nyo, ayan, yung distribution niya. Okay, so that ends the discussion for the integumentary system. So the next naman na i-discuss natin is the assessing the head. So sa next video na naman yun siya. Okay, para naman mas ma-internalize ninyo yung diniscuss natin for this video na assessing the integumentary system. Again, pag sabihin po nating integumentary system, this includes the assessing the hair, assessing the skin, assessing the nails, and also the glands. Kasi yung excretion ng ating patient, kung profuse ba yung kanyang sweating, okay, very oily ba yung ating patient, very dry. Okay, so please take note of those na ano yung kailangan nating observe. Again po, when it comes to assessing the integumentary system, we just use the methods of inspection and palpation. We do not somewhat percuss and auscultate kasi wala naman tayong pinapakinggan sa ating skin, sa ating nails. More on inspection lang and palpation. So, I hope may naintindihan kayo sa discussion na ito or sa video na ito. Okay? So, thank you for watching and have a nice day.